Canada is currently facing an epidemic of opioid abuse. Opioids are a class of drugs that are commonly prescribed for control of moderate to severe pain. These drugs can create a euphoric state which deems them highly desirable and very likely to be abused. Commonly abused opioids include heroin, morphine, codeine, fentanyl, Demerol, oxycodone, and that's just to name a few. Heroin is a synthesized form of morphine, and is the most frequently abused non-prescription opioid substance on the market. There are many ways that people go about abusing these types of narcotics, including crushing them, smoking them, and one of the most dangerous ways, injecting them. It is estimated that in 2012, there were 75,000 to 125,000 injection drug users and 200,000 individuals dependent on prescription opioids in Canada alone. As the number of IV drug users continues to increase, the chances of spreading diseases like HIV and hepatitis increases as well. In 2016, data indicated that there were 2,458 apparent opioid-related deaths in Canada. The apparent opioid-related death rate in Canada is currently 8.8 per 100,000 people. To date, British Columbia is the only province in Canada that has implemented supervised injection sites. These supervised injection sites work on a harm reduction model, which means it strives to decrease adverse health. Staff will supervise and monitor clients for signs and symptoms of an overdose, teaching clients safer injection practices, and refer clients to other healthcare services such as substance use treatment and counseling. The number of overdose deaths in BC is increasing, and it's not just BC, it's across the nation. An analysis showed opening a second safe injection site has the potential to prevent 13 cases of HIV, 5 cases of hepatitis C, and 2.3 fatal overdoses per year in British Columbia alone. In 2012, Toronto and Ottawa Supervised Consumption Assessment Study recommended that Toronto and Ottawa create 5 safe injection sites. However, the Ontario Minister of Health and Long-Term Care, Deb Matthews, rejected the proposal and said that Ontario has no plans for pursuing safe injection sites. During the time of the proposal, Ottawa had one of the highest rates of HIV and hepatitis diagnosis among injection drug users in Canada. Officials across Canada believe that healthcare dollars are better spent towards rehabilitation facilities rather than safe injection sites. Research shows that opioid drug users who come out of drug-free rehab programs are at an increased risk for overdose upon returning to opioid abuse. Although we show great need for safe injection sites, bills like C2 and C65 are making it excessively difficult to open new facilities in the country.
Opioid use is an escalating issue in Canada that requires prompt attention. There are some harm reduction strategies that have been implemented, but the need for policy change towards safe injection sites needs to be addressed. Healthcare professionals, such as physicians, pharmacists, and nurses, as well as law enforcement officers, policymakers, and members of the community, need to be included in discussing how to approach this epidemic. Physicians and nurse practitioners who can prescribe opioids will need to be involved in implementing new prescribing guidelines as well as treatment options for opioid use. It becomes clear that interprofessional collaboration, the knowledge of the need for change, and the strength of leaders across the country can bring us Canadians together as a nation to fight the war on opioid drug abuse. By implementing safe injection sites nationwide, we can create a world with less disease transmission, less death, and provide a cleaner planet for our children to grow within. As nurses within Canada, it is our duty to become advocates, as we are most often the first point of contact for individuals suffering opioid use disorder. We play a critical role in assessing, diagnosing, and promoting harm reduction. Treatment options currently available on the provincial level in British Columbia need to be extended nationally, and with nurses as leaders at the forefront of the battle, the hurdles posed by Bill C-65 can be overcome. Let's all be leaders.